Good afternoon, everybody. Welcome to our media question and answer time, our update about COVID-19. Today is Thursday, May 6th. Happy May. It's nice to see spring weather coming back. Today will be our last regularly scheduled media briefing on Thursday afternoons. I really appreciate the media partners that we've had on this journey with us. You've been diligently part of our briefings for the last 14 months, and I've really appreciated your questions, your interest, your commitment and engagement for this community. That makes a world of difference. This has been a community issue, and having community-based media part of sharing the conversation about what's happening is really, really important. While this scheduled Thursday afternoon time won't be ongoing, we will be continuing to be available to the media to provide public health perspective, public health expertise, both about the pandemic and about all the other topics that we talk to you about regularly. At this stage, we'll be shifting to providing media briefings as needed when there's a new or different piece of information that we need to get out broadly. In the meantime, though, please, everybody that's listening, do go to our website, covid19eauclair.org. We are updating that every day with new information. And also follow us on Facebook, Twitter, to stay updated on a more regular basis. I do want to take a minute to share a couple of special thank yous. First of all, to Don Koplitz for providing ASL interpretation, and to Valley Media Works for providing closed captioning for these briefings. That makes an enormous difference, and we really appreciate the partnership of both of you. My special thanks also goes out to the team here at the health department that has made these briefings happen. So particular thanks to Audrey and Gina and Janessa. This team, particularly Audrey, have really made it possible to do these briefings every week in the way that we've been doing it. So thanks to that group. As usual, we'll go through some basic data. We'll follow up with some updates on a local and state level, and then we'll be available to answer questions that the media has, both ones that we got in advance as well as any that you put in the chat box that Audrey will share with me. At the very end, we can also open it up for additional questions that people have at that point in time. So as related to data, we now have 11,500 Eau Claire County residents that have tested positive for COVID-19. Again, a large amount, more than 10% of our population since the start of the pandemic that has tested positive for COVID-19. We're averaging about 6 cases a day at this point. We have 86 estimated Eau Claire County residents that we're actively working with to remain isolated, plus all of their close contacts, so that we slow the spread of disease down, and we continue to work on that as a health department. 392 Eau Claire County residents were ever hospitalized as part of COVID-19 pandemic, and we've had 107 individuals that have died. I do want to note that hospitalizations and deaths were slightly adjusted because of state data cleaning, so people may have noticed that. A couple of other data points for you that we share with you weekly. Our UW Eau Claire case data are remaining about 13% of our total cases since the beginning of September. This percentage has remained very steady. We have 5 active public health investigations. Really good news that none of those are in long-term care settings, only one in an educational setting. Really good progress. Vaccines are making a difference in both of those settings to not have as many outbreaks happening. Our state rating for COVID activity remains high with 97 cases in the last 2 weeks. Our trajectory remains flat. Again, good news, even though that we're in the high category from a state rating, we really have kept our case numbers consistently lower over the last several weeks. Testing has remained flat, 214 tests a day on average. Our regional hospital bed capacity has been solidly good, and our community spread of disease has remained fairly consistent, around 45% of cases don't know where they got their COVID-19 case. That does remain in the red. We continue to have some challenges with people that are identified as COVID positive and their close contacts answering our phone calls. So our follow-up with cases and close contacts remains in the yellow. Our vaccination measure that we name weekly remains green, and we anticipate that to remain green moving forward. There are immediate appointments for vaccine for COVID-19 in the county, and they're readily accessible. A couple of other notes about things that are going on related to data. So a couple of vaccine measures. We are now at 86,237 total doses of COVID-19 vaccine given in Eau Claire County. Again, that's a broad range of vaccine providers, our healthcare providers, our pharmacies, as well as the health department. Our average new doses by week has fallen significantly. So we are seeing across the county, across the state, and across the nation that those first doses of vaccine volumes have been going down. We certainly have gotten a lot of vaccines in arms, and many people are vaccinated, but we still have a long way to go. 46% of Eau Claire County residents have completed at least one dose of vaccine. And again, a reminder that those 16 and older can get vaccinated. 40% have completed the entire series. 83% of those over the age of 65 in Eau Claire County have gotten one dose, and 79% have completed the series. Again, really solid percentages. We still have a bit of ways to go even with that population and getting completely vaccinated. A reminder that there are many places to go to get a COVID-19 vaccine. You can go to our website, covid19eauclaire.org. We regularly update that site where you can click on the button about vaccine appointments. We list there all of the Eau Claire-based locations. You also can text your zip code to 438829 to get a list of vaccine providers near you. If you'd like, you could also go online at the state website, and they do have a vaccine finder location on the state website with a map that can show you where vaccine locations are. The Zorn Arena site on the UW-Eau Claire campus continues to be a really solid option available to everybody. Very easy, 5 days a week, Tuesday through Saturday, both walk-ins and appointments. So anybody over the age of 16 can get a vaccine there. Pfizer is the vaccine at that location. Starting this week and moving forward, hopefully next week, if we get supply, we will have Johnson & Johnson vaccine also available at Zorn Arena. With the pause in that vaccine being available earlier in the month and last month, we know that Johnson & Johnson is something that many people would like to get because it's a one-dose vaccine, and we may have limited supply. We hope to have that available regularly, and we certainly will be letting people know if it's available at the Zorn location. Again, a reminder that that site is open for appointments Tuesday through Saturday this week and next week, 11 a.m. to 7 p.m. Please make an appointment if you can at vaccinate.wi.gov. Otherwise, walk in, and your vaccine will be very quick and very easy. Parking is less than a block away. No identification is needed for that location. We also, as a health department, are doing a lot of pop-up or on-site vaccination efforts. We've been at churches and at employment locations for the last couple of weeks, and we are continuing to do that. We'll be giving vaccine at the Altoona River Prairie Festival this weekend, as well as at the Eau Claire Farmers Market. So come find us there. We really hope to have a variety of vaccines to offer at these clinics, depending on available supply. And we want to make it easy for people. We know for some it's not as easy to really go through the effort of going at a specific time on a specific day. And if you are out and about at these other events, we hope you take advantage of the opportunity to get vaccinated. If you see our tent or see our signs, come over and talk with us. If you have questions or hesitation, we can talk you through that, or just come and get a vaccine. In 20 minutes or less, you'll be on your way, even with that 15-minute waiting time after your vaccine. We really see an opportunity for all of us to help support those around us by getting vaccinated. Parents, you can get vaccinated because you want to help your kids that can't yet be vaccinated. Community members, get vaccinated so we can continue to see progress in this pandemic and really have a summer that feels and looks and is much more normal for all of us. We're all eagerly awaiting that. This can bring us together. We can partner to really encourage one another to be vaccinated as one of the ways that we continue to move forward. Please find ways to help one another to make that happen. Finally, I want to share Happy Nurses Day. Nurses have been on the front line of this response for this entire year. Nurses in clinical settings, in hospital settings, in schools, in the health department, across our community, are doing a lot of work to keep us safer and healthier. Thanks for your caring, for your commitment, for your willingness to say yes to making our community healthier and safer, even with a lot of pressure and a lot of challenges. I really want to say I'm proud to be a nurse. I'm proud to walk with you in that. And it's been a tough road, but I'm really proud of the nurses across Eau Claire County in all of those settings that have made an enormous difference. I've been mentored and guided by many nurses in my life, and I also want to thank them. And I also work with a team of amazing nurses at the health department. So thank you to that group. You've made a difference to me and to so many others. So if you know a nurse, please thank them. It's Nurses Week starting today, but today is particularly National Nurses Day. So a couple questions from the media in advance, and then I will turn it over to Audrey. There is a set of questions about a few other countries that are encouraging people to look at mixing COVID vaccines. For example, getting one dose of one type of vaccine and then follow it with a dose of a different type of vaccine. Why might they make that suggestion? What impact could that have? And what is right now the recommendation about vaccine mixing? So a couple of points to make related to this. There is some evidence from other vaccine preventable diseases that using different kinds of vaccine can help your immune system if it gets exposed to the actual virus. Different kinds of vaccines might prepare your body slightly differently. But at this point, COVID vaccines and the guidance from CDC and the state is to not mix vaccines. And it's important right now to follow that guidance. As we learn more about this specific vaccine, and as the state and the federal government provide guidance for us on that, we'll absolutely share that. It does mean if you get the Pfizer or the Moderna vaccine for your first dose, get the same one for the second dose. That's your best practice. If you get Johnson & Johnson, you only need to get one dose. Don't get any other vaccine at this point in time. All three vaccines are equally protective. They've been well studied. They are safe. They will prevent serious illness, hospitalization, and death. And really very, very strong outcomes with all three vaccines. At this point, we don't yet know if a booster shot will be needed. There'll be more research on that. It's ongoing right now. And we are sure that we will get more information as time goes on, really what the next step related to vaccination is. So with that, I'll turn it over to Audrey. Are there any questions in the chat?
Yes, we have a question about what you mentioned regarding pop-up vaccination clinics at River Prairie and the farmers market as examples. Are these part of a larger strategy to move towards smaller, more targeted vaccination clinics? And why might these be more effective to people who are hesitant?
Yeah, thanks for that question. Our efforts around going out in the community are similar to efforts that are happening in other parts of the state. Going to employment sites, going to places where people are, really are seen as opportunities to make it very easy to get a vaccine. It is a strategy that does make a difference for many of us who have busy and complicated lives. If we have it in a space or a place that we are already at, whether it's our employment site or a smaller site that we happen to be going to anyway, it really makes it simple and easier to say yes. So, yeah, part of the strategy is going places where people already are and making it easy for people to say, yeah, I can do that. And in a short amount of time, they can get their vaccination completed and be on their way.
That was the only question in the chat box. Would anyone like to unmute and ask a question directly? Oh, there's another question that just came in, Liska. Do you think the mask ordinance will expire earlier than planned?
So the mask ordinance in Eau Claire City and Eau Claire County is set to expire at the end of June. I would anticipate there may be conversations prior to that, but the CDC and the state evidence and requirement at those levels, that their expectation is that masking will make a difference for now. So we are continuing to see CDC and the state really continue to name that masks make a difference and are an important part of our many layered strategy. That will be, I'm sure, part of the local conversation, but I anticipate that we will be talking about that in the next several weeks.
Any other questions for Liska? Feel free to unmute and go ahead and ask.
All right. With that, again, thank you for joining us. Thanks to the community for joining us as well. COVID-19 eauclaire.org is a website that has a lot of information as we move forward. We will be continuing to update that. You can also, if you have individual questions that aren't answered at that website, please call the call center 715-831-7425. And again, thanks for these briefings. Thanks to the community as well as our media partners. It's a chance that we've had to connect with the community, and it's been really appreciated. Take care, and I hope everyone has a good weekend.